All right, let's talk about those tiny, persistent white bumps you sometimes see on your skin. You know the ones I mean. They're not quite pimples, and they can be a real pain to figure out. So in this explainer, we're going to dive deep and find out exactly what they are, where they come from, and maybe most importantly, what you can and can't do about them. I mean, have you ever looked in the mirror and just spotted these? They're not really a pimple, definitely not a blackhead, so what are they? Chances are you've seen them on yourself, maybe a friend, or even a brand new baby. Well, turns out they have a name, Milia. A single one is called a milium. And the cause is actually surprisingly simple. It's all about keratin, that super strong protein that makes up your hair and nails. What happens is it gets trapped just under the surface of your skin, forming this tiny little cyst. Okay, so now we know they're called milia, but what exactly are we looking for? Like, how can you be sure that's what you're seeing on your skin? Let's take a closer look. So, milia have a few telltale signs. They're these small, dome-shaped bumps, usually white or kind of yellowish. Now, here's a key difference from other skin stuff. They're not typically itchy or painful. The only time they might get a little red is if, say, a rough shirt rubs against them. And you'll almost always find them on the face, especially around the lips, eyelids, and on the cheeks. All right, the next logical question is, why do they even show up in the first place? And here's where it gets interesting. The answer actually changes quite a bit depending on how old you are. Let's start with the group that gets them the most, newborns. Okay, get ready for this number. A staggering 40% of all newborn babies develop milia. That's huge. So if you're a new parent and you've seen these little bumps on your baby, trust me, you are not alone. It's incredibly common and, as we're about to see, totally normal. Now, this brings up a super common mix-up. A lot of parents think it's baby acne, but they're actually very different things. See, milia are all about that trapped keratin, and they're usually there right from birth. Baby acne, that's triggered by the mother's hormones, and it usually pops up 2 to 4 weeks after birth. Plus, baby acne causes inflammation and swelling, which you just don't see with milia. Okay, but what about older kids and adults? For us, milia are often tied to some kind of skin damage. We're talking about things like blistering from poison ivy, burns, or even just long-term sun damage. They can also show up as a side effect of using certain steroid creams, or after skin resurfacing procedures like dermabrasion. And sometimes it's just a part of the natural aging process, as our skin's ability to shed old cells slows down a bit. And get this, not all milia are the same. Believe it or not, dermatologists actually have different categories for them, all based on what causes them and how they show up on the skin. So it really breaks down into two main types, primary and secondary. Primary milia are the ones that pop up directly from that trapped keratin we mentioned earlier. That's exactly what we see in newborns. Secondary milia, on the other hand, look pretty much the same, but they show up after something has clogged the skin's ducts, usually because of an injury or a burn. And even within those two big categories, there are a few different kinds. You've got neonatal milia, that's the super common one in babies that just goes away on its own. Then there's traumatic milia, which is a perfect example of the secondary type. It shows up right where the skin got injured. There are even rarer types like milia and claque, which can be linked to other conditions and form a larger patch. And then you have multiple eruptive milia, which are these itchy clusters that can appear over a few weeks or months. Okay, so we know what they are, and we know why they show up. Which leads us to the big practical question. Should you do anything about them? To treat or not to treat? For any parents watching, the answer here is really simple and honestly pretty reassuring. In newborns, milia are completely harmless. They almost always clear up all by themselves within a few weeks. So the most important thing to know is no treatment is needed. At all. Just let them be. Now, for adults, the story is kind of similar. They're still harmless, and they often do disappear on their own. But it might take a few months. However, if they really bother you, maybe for cosmetic reasons or if they're causing any discomfort, there are definitely professional treatments you can look into. So if you do decide to go see a dermatologist about milia that just won't go away, they've got a whole toolkit of options. They can use cryotherapy, which basically freezes the milia with liquid nitrogen. There's a procedure called deroofing, where they use a sterile needle to get the contents out. They might also suggest topical retinoids. Those are vitamin A creams that help your skin exfoliate. And then there are things like chemical peels or even laser ablation to remove the cysts. Okay, I really have to stress this next point because it's so important. As tempting as it might be, please do not try to pop or pick at a milium.
This is absolutely not a do-it-yourself job. You could seriously risk scarring or causing an infection. The only safe way to deal with them is to see a dermatologist or a healthcare professional who can properly diagnose and treat them.
And finally, here's a little bit of practical advice. If you feel like you're someone who's prone to getting Milia, it might be worth playing detective with your skincare products. Some people find that certain heavy oil-based ingredients can be a trigger, so things like liquid petroleum, paraffin oil, petroleum oil, basically different types of mineral oil, and lanolin can also be a culprit for some people. Might be worth checking your labels. Okay, so we've covered a lot of ground. What are the most important things to remember about these tiny white bumps? Let's boil it all down to the key takeaways. Okay, here's what you need to remember. First, they are just harmless cysts filled with trapped keratin. They are super common in newborns and usually just go away by themselves. In adults, they're often connected to skin damage or just the aging process. And remember, they are not baby acne. While you can get them professionally removed, you should never, ever try it at home. And lastly, it's possible that certain product ingredients might be a trigger for you. So in the end, while Milia themselves are harmless, their appearance, especially in adults, can kind of be a little message from your skin. It might be a sign of long-term sun damage, a reaction to a product, or just a part of how your skin is changing over time. So maybe the real question isn't just what are these bumps, but what is my skin trying to tell me? And learning to listen to those little signals, well, that's a huge step toward understanding your skin better.